According to the United States Centers for Disease Control and Prevention, the number of people a person diagnosed with COVID-19 is likely to infect is 2.5, and there is a 75% chance of persons contracting the virus from an asymptomatic carrier. During a recent virtual interview with Nightly News, Deputy Chief Medical Officer Dr. Karen Gordon-Boyle disclosed that 40% of the country's positive cases are asymptomatic. The Ministry of Health on July 17 introduced a new criteria for the release of asymptomatic patients, which was recommended by PAHO WHO. The guidelines stipulate that 10 days after testing positive for COVID-19, patients who no longer exhibit any symptoms on the last 3 days of institutional isolation can be discharged. The Pan American Health Organization World Health Organization country representative, Dr. William Adukro, in sharing his view on how asymptomatic carriers can be detected effectively, noted that considerations should also be given to persons who develop the symptoms after being tested too early.
If we're able to remove the pre-symptomatics from the population of asymptomatics, then we'll know the true asymptomatics and then begin to find out what makes them asymptomatic so that we can guide ourselves in terms of testing criteria.
Pre-symptomatic people are those who are carrying the virus and later go on to develop symptoms, while asymptomatic refers to people who do not show any symptoms at all. Last week, a total of 134 new cases were registered, which aided in the number of cases surpassing 700. Notably, the testing capacity has significantly increased over the past 2 weeks. In excess of 3,000 additional tests were carried out, which led to the detection of more than 200 new cases. Dr. Gordon-Boyle informed that the ministry is aiming to complete at least 300 tests per day. Additional medical personnel are being trained to provide a 24-hour operation at reducing backlogs at the laboratory.
We still have not tested enough. As I mentioned, some regions, not at all enough. So we got a lot more testing to do. We need to try and reach like a level of like 300 tests a day before we're going to really be saying something.
Dr. Dukro, in response, opined that while increased testing is appropriate, strategically identifying those who need to be tested is equally important.
And also make sure that we test those who need to be tested. There's no point just testing because we want to test more and more people because I want to know my status. No.
The Ministry of Health has since made it mandatory for everyone in the public domain to wear face masks. Tamika Rodney reporting for the HGP Nightly News.